Two things that really stood out to me about the preventive medicine program at Stony Brook was the mentorship and the variety of rotation sites.
I was an OBGYN physician. I worked in the military, so I had the experience of some leadership roles. And then I went out into private practice. A lot of the medicine that I was providing wasn't really taking care of the underlying problems in our society.
I got into a family medicine residency, and it turns out that I couldn't write a prescription for a lot of what was happening with my patients.
We're looking to keep people healthy rather than find disease later on that we could have prevented.
Everyone is very interested in what my career goals were and what my interests were and how the program would be able to kind of tailor this experience to also incorporate those goals.
My favorite part of being the program director is mentoring. I think that's my passion.
Dr. Lane is essentially the queen of preventive medicine. And she has so many connections. She has been so involved in foundational preventive medicine leaps.
I get to identify what areas really turn them on, what their passion is, and I try to tailor the program as they get into their senior year so that their rotations and the contacts that I can put them in touch with bolster their experience.
She just allowed me to explore, to find what I really wanted to do.
They have lots of mentors. They have a field mentor. They have people in the master's program. Our faculty really enjoy working with them, so there's no shortage of mentors.
If a resident wants to do cancer research or wants to learn about cancer prevention and control, we have a multi-million-dollar center where the residents can participate in the research. We have a faculty member who's in our department, actually several, who are part of that cancer center who love to work with residents. If a resident wants to work on nutrition, there's a nutrition division in our department.
There's faculty within the department who's working on cervical cancer screening, who's able to just reach out to her and start working with her kind of immediately. I think that speaks a lot to how involved the faculty are and how willing they are to really work with residents and get them involved.
During the first year, the field rotations focus on some foundational areas that all the residents should get. In the second year, the rotations really are mainly electives, and we have a wide variety of electives to choose from. And they all spend in their senior year time within the employee health service and also do telepreventive medicine during that block. If someone has an interest in a particular area, then we can select rotation sites that will build their experience.
We also have the ability to travel into New York City for any rotation that we may want to do there.
One strength of the program, I think, is that the site supervisors are graduates of the program, so they know how to structure it so that they'll get the most out of it.
That adds a really nice level of confidence and comfort for the residents so that when they go out into these sites, there's already an understanding of what the role of preventive medicine is.
Many of our residents go on to do very interesting rotations that are nationally competitive. One of them is the United States Preventive Services Task Force in Maryland. And so our residents get an opportunity, including myself when I was there, to work on those guidelines directly with the people who are developing them.
We are implementing a telemedicine preventive medicine clinic. And I am the first resident who has been able to actually see patients for preventive medicine.
Started with lifestyle medicine a few years ago, which was a new direction things were going in, and integrated medicine, and now telemedicine. And we like to be on the cutting edge, and I'm proud of that.
We have a Thursday where all the residents get together, and we have different classes, but one of my favorite portions of that is we will have people from different areas within preventive medicine actually come and talk to us, and they tell their journey. So they say exactly where they were, what they did when they were here as a preventive medicine resident, and then what they're doing now. And it really opens our eyes to all the different possibilities that are out there.
they get a real sense of what different careers within preventive medicine are possible.
We can directly network with them. So what this program is great about doing is making the introductions, introducing all of us to each other, and I think that that will probably last long past the residency.
The residency program also pays for us all to go to the national conference, the Preventive Medicine Conference. So it's really cool to be there because we're all there together from here, and there are other graduates that have come from the program that we meet with.
You can do your classes in the MPH at the same time that you're rotating. So you are able to apply what you're getting from class to an actual rotation and have that practical aspect simultaneously.
I was actively learning and actively implementing the things that I was learning.
I have been so happy with the MPH program here. I have met incredible, inspiring professors.
Because I already had my MPH, it gave me the opportunity to explore the things that I was interested in that I wouldn't have been able to do otherwise.
It is a big academic center, and because of that, you have access to researchers in public health who are looking into domestic violence, violence on campus, looking into global health issues, epidemiologic issues. We have great clinicians here who are doing clinical research in exciting areas.
The Residency Research project is a great way for the residents to really solidify skills in research. They get to implement or demonstrate the skills that they learned in biostatistics and the other MPH courses.
I think even though we are not working directly together on different rotation sites, we're still able to develop a strong connection.
We have a lot of variety in our residency. You have people like me who might have had a career for 15 years in another specialty. We have people who come right out of their first year of residency and medical school. We come from different areas in the country, and we come from different backgrounds.
It seems that every group of residents that join our program, they immediately connect with each other and become a tight-knit group.
It's not just about the strength of the program and strength of the institution, it's also making sure the residents are supported as they go through the journey with us.
Stony Brook does a really great job of kind of showing how much you can do within this field.
Since graduating from here, I started in a fellowship program in osteopathic neuromusculoskeletal medicine at Stony Brook, Southampton.
It was easy for me after residency to find a place where I fit and to find a place to be, like my job at iPro, which I absolutely adore.
It is a strong program that sits within a strong institution. And between those two, the residents will really get the best opportunity for training that they can get anywhere.
We've had people at all, at many agencies, CDC, NIH, FDA, AHRQ, the whole alphabet. If you name it, and I'll tell you somebody who, who's working in that area.
I love going to work every day. I'm doing what I was made to do.
You're not just a resident, you are a person who has something to bring to the table. You're not just a worker, you are an individual who is a part of a family, a part of a team, and you have so much to offer, and that's what made it a really special experience for me.
This program really gets you to where you want to be.